My name is Alethea Jones. I am currently the director of the Open Society Fellowship Program. I joined OSF 3 years ago, and it's incredible to be part of this wonderful legacy of this program. We are 50 years into an unwinnable war. We each have our own journeys on this topic. My journey starts in Jamaica, the country of my birth, and a country that is synonymous with the once illicit crop of marijuana. I went on to a career of studying migration and immigration, which intersects with the drug wars and gangs as part of that research, and also have a history in AIDS research and the impact of drug use in Black communities in the United States. The idea for this event comes from our Global Drug Policy Program. I was so delighted when they raised the possibility of this event, and it's really a testimony of the leadership of Kasia Malinowska-Sembrock, the director of the Global Drug Policy Program, as well as colleagues within our public health program with their harm reduction initiative led by Danielle Wolf. Our hosting of this event is also a testimony of the partnership between the fellowship and other units within the Open Society Foundations. Fellows are independent voices who share their unique perspective and expertise with us and often challenge our assumptions and push our thinking. In other words, they make things uncomfortable, and they do so for the greater good. The Global Drug Policy Program has embraced these principles as they've embraced these fellows. It is truly an honor to meet each of you and to be part of the legacy of the fellowship program, much of it defined under Lenny Bernardo and Steve Hubble. I want to share with our audience as folks sign on that as fellows during your fellowship year, collectively, you conducted over 600 interviews and visited over 30 countries. And you really used the time to amplify attention to your topics and to influence policy formation. So I'll go ahead and introduce each of you by acknowledging how you have challenged us. Liz Evans, you compelled all of us to rethink harm reduction. You demonstrated the ethical value of supervised injection sites as a place to recognize the full humanity of those of us who use drugs. Greg Gonzalez, your advocacy for accountable policymaking in public health is unsurpassed and demonstrates why and how we must systematically cultivate bold civic activism and the lasting policy change that it will bring, both in the areas of HIV/AIDS and beyond. Vonda Felbab-Brown, your unprecedented research on illicit economies and the social and legal regimes that sustain them reminds us that we create the illegal and often do so at our peril. Each of you are individuals with intellectual, with intellectual and moral courage, pursuing the truth as you see it, even when it is unpopular, and you're often ahead of where the field ultimately needs to go. As I turn things over to Dr. Helena Hansen as our moderator, who is a leader in the field of addiction therapy in her own right, she will lead the discussion and the Q&A session, and I will rejoin at the end to close out the program. Over to you, Helena.
Thank you so much. I just want to take one moment to appreciate that on our panel are leaders in 3 of the most influential social justice movements of our time: AIDS activism, harm reduction, and resistance to the militarization and criminalization of drug policy through the war on drugs. So these leaders, their movements, have profoundly shaped my career I became an anthropologist and addiction psychiatrist because of my involvement as an undergraduate, beginning as an undergraduate student in all three movements. And their work has guided me to my current focus on racial capitalism in drug and pharma industries. These leaders have also shaped the politics, and their movements have shaped the politics of the late 20th and 21st century into the 21st century. So it's just profoundly an honor to be moderating this panel. So I want to get into the first round of questions, and I'm going to turn to Liz Evans first. How has the punitive approach of the war on drugs shaped policies and services aimed at people who use drugs around the world? And what are the consequences of this restrictive lens and the exclusion of people who use drugs from policy and service design?
Thanks, Helena, and it's lovely to be here. And I do want to just acknowledge that you've each made phenomenal contributions, and I'm incredibly honored to be alongside each of you. And also to just thank OSF for bringing a global community of people together to care about drug policy, because it's not an area that's studied or cared about enough. And OSF's work really does have lives depending on it. But I've been incredibly sad many, many times and quite overwhelmed by the brutalizing context of the war on drugs. So even just those of you who are here joining this panel today on Zoom are part of the solution, because really it takes enough people to care to do something about changing this. My own story and my own role or witness to this brutalizing war began when I was working as a nurse in a very low-income neighborhood where there was about 6,000 drug users living in desperate poverty. And as a nurse, I really had to rethink everything. I came to the work thinking I knew. I thought I could come and I could help, I could do something. And I had to really confront my own drug war-infused thinking and assumptions that I made about people who use drugs. I watched people die. I found Indigenous Granny Matilda in her rocking chair with the needle still in her arm dead, and then months later found her daughter also dead. There was no public outcry. I felt like I was immersed in this horror show that nobody cared about. So just that experience really sort of turned everything upside down. I gave up my nursing license when I was working in the neighborhood because what I didn't need to bring really was my medical knowledge. What I really needed to bring was my humanity and a slightly more critical practice of what was going on. So I had to confront social injustices, structural inequalities, racism, classism, and just the overwhelming amount of a lack of care to people who were seen as dispensable ultimately. And it was that sort of overwhelming narrative that I think that the war on drugs has allowed and made justifications for, so that people who are suffering and struggling and dying in overwhelming numbers are generally not seen as legitimate human beings, because having a criminalized approach and system has allowed us to see certain people as disposable. And in the 90s, when I began this work, one of the most dramatic examples of this was the missing women. There was over 60 Indigenous women who were murdered brutally on a pig farm and disposed of by somebody named Picton, who we had reported missing, many of us in the neighborhood, and the police didn't even investigate the missing women for over a decade. So it was just a tragic example of these 60 Indigenous women, many of whom were drug users. Anyway, what I've learned since in being involved in OSF is that this story is the same everywhere. I mean, obviously in some cities it's even more brutal. There's torture, people are imprisoned. The story of who a drug user is in society is defined by the derogatory terminology. People are called junkies, zombies, the walking dead. And so they're not just criminalized, they're shunned socially. They're driven to the outskirts of town. They're left to sleep outside. They're denied access to physical spaces, harassed by security. They're not allowed into housing or provided with jobs. They're not even given access to basic life-saving supplies that they need to prevent from getting infectious diseases. And then, of course, they're dying of overdose stress. And I think the drug war and its narratives and policies have been responsible for a distraction by blaming individuals as a result of their drug use on what are ultimately systemic problems, violence and systemic violence that is justified as a result of drug war policies. We end up using disease models in some cases as well. by looking to alleviate the burden of thinking about those social determinants of health. So I think both the criminal narrative and the medical narrative lack the ability, or they possess the language that distracts from the larger problems. I don't think that the war on drugs started out being a war on drugs, really. Maybe it did, I don't know. I'm not an expert in that field, and I'm glad that Vonda is here. But I think that the truth is the war on drugs isn't about drugs at all. But drug policies have resulted in being responsible for just so much destruction and so much death, and ultimately a toxic drug supply that has now killed 93,000 people in the US last year. And then also cultures where people have to hide their drug use, are terrified to admit they're drug users, and policies and service cultures that are also punitive and punishing. So we see women being taken away, having their children taken away from them. We see women being sterilized. We see drug users being denied access to healthcare unless they commit to being abstinent. We see incredibly draconian policy environments where people are basically treated extremely they're not treated as people with rights or agency. And so we've made rules and created subcultures that are not actually around human beings. They're around products of drugs, people who are not seen as agents of their own life. I mean, it began years ago with needle exchange. Even when that first rolled out, I started watching, we were handing out needles to people, and we were only allowed to hand them out if we could collect a dirty needle in exchange. It's just a small example, but this idea of a barter system, you have to give me something in order to get this thing that is going to stop you ultimately from getting an infectious disease. And yet at the time we had an HIV epidemic that was just horrific. And so people were selling the needles we were providing to them outside on the street for $5 because there were just not enough. So we just started providing them, but that went against all of the policies at the time. We were supposed to be responsible with our syringes. There was even a 3 needle a day limit at a time when people were using polysubstances, including cocaine and heroin, in huge numbers. Anyway, early methadone programs, similarly extremely restrictive. We had to take, people have to pay money to get there, go across town, comply with urine testing, et cetera, et cetera. And in the end, we were part of a group of folks that set up something very low barrier with the College of Physicians, where people who were drug users could get methadone in their housing. And we saw a phenomenal shift in people just becoming increasingly stable. I think the drug war has created an opportunity to justify violence and often shaming and often cruel and misguided interventions that have sadly missed the mark. And I think listening to people who use drugs and working in community and working alongside people has just continued to open up spaces where we can do things differently. And, I had to learn myself how to unlearn so many things and just listen and walk alongside people. And really, I think that that's where there are now many pockets of brave, courageous people trying to make those sort of spaces available now.
To take a moment to absorb that, so eloquent and moving, Liz. I want to turn to Greg Gonsalves. Misinformation and pseudoscience have been a significant barrier to moving beyond the war on drugs. And similarly, during the COVID-19 pandemic, we've seen a high level of misinformation and anti-science rhetoric. What parallels do you see in the misuse of science and expertise as it relates to drug policy? And how can we combat this misinformation and advance policies and practices? Are you unmuted?
I'm unmuted.
There we are.
So, my colleague Forrest Crawford and I here at Yale wrote a paper a while ago about the Scott County outbreak of HIV among people who use drugs. And we used a mathematical model to show that, basically if you had done just HIV case finding 2 years earlier, 3 years earlier, you would have stopped that epidemic in its tracks. And Chris Beyer from Hopkins wrote a piece in the journal Lancet HIV that said, accompanying the article, saying no more Scott counties, right? We shouldn't see more of these kinds of outbreaks. We have the tools we need to stop these epidemics from happening all around the world. Since then, Seattle, Boston, Massachusetts, several counties in West Virginia, Northern Kentucky and Cincinnati, Miami, Florida, we've had more than half a dozen Scott counties roll out. And it leads me to the question: does data matter? Does data matter in making the lives of people who use drugs better? I have a friend of Leo Beletsky, who's probably friends to many of you on this call, and we argue about whether we need more data to support the use of harm reduction in the context of preventing infectious disease or more humane drug policy. And Leo and I go back and forth whether this is a political question or it's an evidence and information question. I think it's both. What's interesting to me is that the Scott County Board of Commissioners met a couple of months ago to decide if they were going to close the needle exchange that was opened with some resistance from Governor Pence back then, but finally his acquiescence. And the room was full of people from that community saying how important the syringe exchange was to their lives, to the lives of their loved ones. And one of the commissioners, 2 out of 3 of them voted to close the program, held up an article by Annalisa Packham, who's a health economist, who wrote about how needle exchange was a moral hazard. And I realized to myself, this paper, which many of us had seen, and it has been deconstructed by people who work in health economics, who also work in harm reduction and substance use, realized that evidence does matter, but it can be deployed in ways that you don't expect. And when he raised this sort of obscure journal article, which hasn't even been published in peer-reviewed literature, you realize that data does get mobilized for cross purposes. And so in combating misinformation, more information is necessary but not sufficient to address the problem. Often you need both a political and an evidentiary solution to sort of push through these obstacles. Another conversation I had in the context of what's happening out in the US around needle exchange is with Scott Burris at Temple, who's saying maybe we need to start thinking about what matters to communities beyond needle exchange. A lot of, in my home community in New Haven, which had an early needle exchange, people want to know what's in it for them, right? And we have to sort of think about how harm reduction and the lives of people with drugs intersect in our communities and put adjacent communities in danger, in peril, in other ways, which matter to us as well. And as Helena talked about sort of racial capitalism and the way in which the drug war intersects with that, there's lots of ways to think about how we start to build bridges, right? And combating misinformation, so it's about evidence, it's about policy, but it's about coalition building. And a lot of the work on harm reduction and trying to stop these needle exchange closures has been about the needle exchange, but it hasn't been about the communities in which they reside, right? And trying to think about how we lift up everybody in a community, including people who use drugs, is probably an important thing to think about when you're combating misinformation. And so I'll leave it there for now, and we can talk more about it maybe in the next round of questions. But I think disinformation is a potent brew, not just in the context of the drug war, but often it's weaponized by political leaders who have something else to gain. And we've seen it with COVID, we've seen it with harm reduction, we've seen it with the global drug war. And with Leo, I'd say we have to figure out how to better out-organize our opponents, which we have not been able to do quite yet on the global stage.
So astute and well said. Thank you. So now I'm going to move to Vanda Felbab-Brown. How has the drug war shaped supply-side policies? What types of impacts has this approach had on organized crime, conflict, and security issues?
Well, thank you very much, Helena, for the question, and it's great joining everyone for this conversation. It's a particular opportune moment because we are actually seeing quite some substantial changes in supply-side policies that I hope we will have an opportunity to explore in the second round. But let me first reflect on what became some of the standard supply-side policy from about the late 1970s, early 80s on that were often promoted by the United States, and these days are strongly encouraged and picked up by actors such as China and Russia. Principally, supply-side policies have centered on eradication of illicit crops, of drug plants, and interdiction. Interdiction being the suppression of smuggling networks and the destruction of drug labs. Of course, those are all very broad terms, and there are very many ways to do eradication, and there are very many different ways to do interdiction. So what often emerged over time was insistence that illicit crops are eradicated as the principal default policy in the absence of any alternative livelihoods being in place for the families, the communities that grow illicit crops. Not all communities that grow them are poor, but in vast majority of the time, hundreds of millions of people who are involved in the production of illicit communities tend to be in some ways poor and marginalized, often in multiple settings. And the reason why so much supply-side policy is centered on interdiction stemmed from several reasons. One is that, of course, identifying a plot of cultivation of a drug crop is much simpler than finding a lab or interdicting supply. Despite the fact that the United States usually spends around $40 billion on drug policies, much of which actually is internally, not externally applied, but nonetheless with very vast amount of resources spent, the usual rate of interdiction success is considered about 10%. So the notion was that identifying the origin, the supply, would make it easier to stem the flow of drugs into throughout the networks. So the ease of execution of policy was one factor, but not the sole factor. Illicit drug production has fueled many harms. It provides vast sums of resources of tens of millions of hundreds of millions of dollars to actors like the Taliban that have just come to power, very brutal movements. It often is exploited by very violent actors. The fact that drugs are illegal is not the reason why groups become violent. You can have drug trafficking groups that are very peaceful, and you can have drug trafficking groups that are very violent. But violence is certainly a tool exploited to further one's fortunes in drug trafficking, and it also further enables very violent groups. And of course, illegal drug production, or I would say illegal economy of any kind, also introduces all kinds of illegal money into political systems, advances corrupt politicians, undermines rule of law. So vast illegality, including in the production of drugs, generates all kinds of harms. And so the notion was that if only supply could be taken out, then not only would the price of drugs be higher, hence there would be smaller use, but also that these other considerations of drugs strengthening the financial capacities of terrorist, militant, and criminal groups, fueling corruption, fueling all kinds of political distortions, and repression would be eliminated. That has often not been the case, and in fact, drug policies generated on the supply side a whole variety of problems and threats. They, as I mentioned, they often targeted poor marginalized communities that would bear the brunt without the promised knock-on effects of weakening militant groups, armed groups not taking place. And in fact, in many cases, eradication in the absence of alternative livelihoods being in place, not simply promised, just strengthened the bonds between local population and armed actors, and created opportunities for armed actors to position themselves as providers of benefits to local communities, whether those benefits were resisting rule of law and authority of the state, preventing eradication, or those benefits would be delivering some sort of marginal public services, socioeconomic handouts. Interdiction has also come with a variety of challenges, and I want to emphasize here that a very important part of learning of drug policy is to sort of get away from black and white characterizations and suggestions that particular forms of eradication and particular forms of interdiction generate very negative effects means that we should be doing no eradication or we should be doing no interdiction. We'll be dealing with an existing condition that generates harms. We, however, have to get away from a situation where the policy response generates further harms without addressing the original harms and threats. So what happened with a lot of the way interdiction has been conducted is that it simply shifted the problem to new locales. If it at all succeeded in suppressing flows or dismantling particular criminal groups, it almost never succeeded in taking money away from militant groups, terrorist actors. And in some cases, interdiction centering on so-called high-value targeting could generate significant increases in violence. Mexico is a great case of this very unfortunate development in policy, where the way interdiction was designed significantly exacerbated already pre-existing very high levels of violence. And sort of my last comment is that perhaps one of the most debilitating effects of supply-side policies, and one that policy needs to grapple that is very difficult to address effectively, is that even successes generated unintended consequences and often only shifted problems elsewhere, or mutate or resulted in problems being mutated in ways that could turn out even more dangerous, whether by changing the way traffickers behaved, whether by changing the locale and of supply, or whether it was the supply or the trafficking, or perhaps even sort of enabling the spread of new drugs. My final comment here, however, is that we certainly cannot attribute the emergence of synthetic opioids that have devastated North America to drug policy. Drug policy grapples with it and needs to continue grapple with it, but the emergence of synthetic opioids with all the advantages they give to traffickers is not a consequence of drug policy. It's a consequence of both technological innovations and, of course, of pharmaceutical companies getting vast segments of population in the North America addicted through fallacious policies.
Thank you for such a clear and compelling statement. So now I want to build on what you just all three beautifully opened with a second round of questions. So the first goes to Liz Evans. It's clear that the war on drugs has failed to take a human rights-centered approach to policy and services. How can we shift the framework to ensure a more human rights-centered approach to drug policy? And what barriers prevent us from changing the narrative surrounding drug use and drug policy?
Well, I think one of the stories of the drug war has been that if we simply remove drugs, that we will get rid of the problems. And I agree with Vonda that it's not a black and white issue. Obviously, it's super complicated, and there's many harms, obviously, in fighting against the whole sort of quote demon drug. But I also think that we've been distracted by it, and it's failed to draw attention to the structural inequalities, even bigger issues of drug war capitalism, social determinants of health, and racism. So I think reframing the conversation in our local communities and talking about what it is that we're actually discussing helps people focus on solutions that address these larger systemic problems. And I also think organizations are very scared to take on some of these systems because changing the status quo is difficult, and it means taking risks. So moving from prohibition and punishment thinking to a human rights approach has to start on the ground in communities through community education and activism, taking action and changing public opinion. You know, in the early 90s, when we first started having huge numbers of overdose deaths in Vancouver, we started campaigning and amplifying the voices of the people in the neighborhood because they were the people who were experiencing living what it was like every day to see family members die. we did it in the context of a lot of things. We were building housing at the time, and we were working with people to bring in mainstream services like primary health care, folks that didn't have access to anything else. And we were trying to just provide space where their lives could be celebrated. And the idea of creating an injection site to address the overdose deaths, we borrowed from Germany, and we realized it was completely out of all of the boxes in our community, and no one would even understand or why such a thing would even work. And so we started on the ground working with drug users and talking to tons of different stakeholders about it. And we did at first a poll that showed 20% of people supported the idea, and it was considered completely crazy. We had a lot of opposition as we went along, including a visit from the US drug czar, who told us that we would be threatening our border security, and talked about things like national sovereignty. And I had no idea what he was going on about. And it was just shocking to me, because we were talking about this tiny little speck of real estate on the globe of like 3,000 square feet where we were going to let people come in, inject their drugs, and not die. And yet the controversy it created politically, and the pushback we got over a decade of having to fight, not just to open it and then to keep it open and going all the way to the Supreme Court, was really insane when you think about it. And also more insane when you think that 7 million injections have happened there since it's open, 7 million. And nobody's ever died there. And that's like just one place on the entire planet. It's like, it's a nothing thing, and yet it's effective at the one thing that it set out to do, which is not let people die of overdose. And yet the things that we had to do to accomplish that were just, insane. I agree entirely with Greg that activism has to be hand in hand with community education and data and evidence. And obviously the research around the site was super helpful. But the political will and watching political leaders change their mind happened in tandem with the public changing their mind. And so our opinion polls, after we'd been open for 5 years, were at 76% of public support. And that was because we had opened the site, we saw people support it, we were constantly amplifying through the media the stories of the drug users, the research, the community leaders, the experience of families, and really humanizing and coming back to, messages like before they were junkies, they were kids, just trying to bring everything home to, insight saves lives. Nothing super complicated. This is a very simple thing. The dead don't detox. These really simple sound bites, like things that would make it compelling and understandable about why we were fighting for this space. And at the beginning of our journey, one example of this is that we had a mayor who was very conservative, and he'd been a mayor for a long time, and he came out kind of as a lone supporter before anybody else, and got completely killed by his political party. He was knifed in the back and taken out of the running for the race. But by the time the party was running for the next election, the public opinion had swung. So the very people that had removed him from government ended up running on a platform of being the first to open the injection site. It was just insane. So while I understand that data can be manipulated, but the people on the ground make a difference. The groundswell has to come from the bottom. We have to use our voices and our activism to shift public opinion. And I think that can only happen when we listen to what the community is trying to tell us and what's true. And of course, there's victims all around the world right now who are dying and whose lives are at risk because these voices aren't being heard. And I guess I would just say that, like Bud Osborne wrote in a poem, a beautiful friend of mine, an activist in Vancouver, he said, we make careful and accommodating protests. And I think we can't just make careful and accommodating protests. I think we have to be willing to take those kinds of risks if we're going to be willing to shift public opinion. Brilliant.
Thanks so much, Liz. So on that theme of what an impact organizing can have, I want to turn back to Greg Gonsalves. Considering your work as an HIV activist, how is the context of social movements on HIV/AIDS historically connected to people who use drugs? And how have these movements been impacted by and responded to the war on drugs?
Round up by people who are, can you hear me? Who are the people who are most affected? If we think of the women's suffrage movement, the civil rights movement, it's not external actors who make change. It's the people whose lives matter. And if you think of the first needle exchange opened in Amsterdam by the Junkies Union in 1984, there were people who use drugs organizing together to help each other prevent transmission of hepatitis B, I think, at that point. But then in New Haven, where I'm sitting now, and in Boston, the AIDS brigades were setting up needle exchanges, running afoul of law enforcement. The first needle exchange, I think, opened in Tacoma, Washington. Again, community-based, people living with AIDS and their advocates in 1988. And the Canadian government starts to fund stuff in 1989. But, all this is happening at the same time as the AIDS epidemic is exploding in the U.S. And, there's something called the Denver Principles that people with AIDS enshrined as sort of a political manifesto that said we control our own destinies, we shape our future. And the movement of people who use drugs and the movement of people living with AIDS sort of weaved back and forth over time and place during the AIDS epidemic to create needle exchanges across the country. When I was in ACT UP, there were people like Richard Elovitch, Rod Sorge, Dan Williams, who knew they were breaking the law and put a test case to the courts in New York about the legality of needle exchange. But they won because of the strength of their arguments and the force of the people behind them in their communities. What's interesting is, Kasha's on the call now, and Kasha came to me in 2000, and I hadn't done any work on drugs, and she said, and I didn't know Kasha, and Kasha said, you're going to work on helping to bring together people working on access to AIDS treatment and access to services for people who use drugs around the world. And I said, okay, Kasha, whatever you say, I don't even know who you are. But Kasha really is responsible for leading the public health program, the International Harm Reduction Development Program, to build these new links across the world between people who use drugs and people living with HIV. And I don't think we can understate what that program did. It created a set of organizations through the Collaborative Fund, which I was part of, and the International Preparedness Coalition, which gave people real resources to do the work of advocating for the rights of people who use drugs, not just in the context of democracies like the US and Canada, but in Russia and China and other places around the globe. This program was really, really, really important in doing that. And I do have to end by saying I'm terribly disappointed right now. I feel like Mark Malloch Brown and Alexander Soros have abandoned this generation of people who've been fighting for people with AIDS and people who use drugs by the reorganization of the foundation. I'm sorry, but the dismantling of the public health program and the reorganization to build it up in the image of Mr. Brown and Mr. Soros is absolutely wrong. People feel abandoned. And you know what? It just goes to show you that the people who cared once can find the same people disposable 10, 15, 20 years later. And so we have a fight on our hands. As I told you, we have AIDS epidemics breaking out in people who use drugs across the U.S. And humane drug policy is an exception around the world, even though Vanda's saying, we're having some progress, but humane drug policy is an exception around the world, not the rule. And Open Society Foundations was this predominant funder of this work, and they've abandoned us. I haven't been a grantee for 20 years, but I can tell you that I've talked to people around the world, and they're furious at what is happening now, because we have so much work to do, and the major funder of harm reduction and the fight against the drug war has picked up stakes and said we're not going to do it, at least to the extent that we've done for the past 20 years. Thanks.
Thank you so much for raising the important question of who is taking on this fight. And on that note, Vanda Felbab-Brown, I ask you, considering that the U.S. has been a driver of drug war policies around the world, how have changes in U.S. leadership impacted supply-side policies locally and internationally? And what impact have these changes had? What new drivers of the war on drugs should we look out for?
So for decades, the United States really was the architect of the modern drug policy regime as it emerged after World War II, and really the US already played a significant role in the pre-World War II shape to the drug policy regime. And since World War II, the US also was the principal policeman of the drug policy regime, enforcing it around the world, and as Liz spoke about, down to the point of very high US government officials trying to prevent the slightest deviation, even at the micro scale, from what the US defined as the appropriate approaches, namely punitive restrictive policies domestically that we heard about that had little scope to no scope for even the terminology of harm reduction, and policies centering on eradication and a particular form of interdiction abroad. But slowly, but surely things started changes, and I'll just limit my comments to the supply side. In the past 10, 15 years, the US very significantly stepped away from its role as a global drug policy policeman. And that doesn't mean that the US is no longer making its drug policy preferences known. It obviously does. And the US still defines drug policy and counter-narcotics policies as a crucial element of its exchanges with other countries. But the sort of utter overbearance with which it tended to assume that role has softened and changed. And in fact, we are now in the world where the US is far less obsessed with drug policies in many countries than it used to be, far more internally looking to some extent, or looking at countries that are a crucial supply of dangerous drugs to the United States, such as China and India. On one case, a strategic rival, in the other case, a hope for strategic partner, or countries like Mexico. But even beyond that, there is just more flexibility. We're also in a world in the supply side that is more fragmented, with Russia, China becoming big regional and even at the international level drug policy enforcers, often insisting on some of the very same misguided, deeply problematic policies that the US espoused us for so long, and they're slowly backing away. And so in much of Southeast Asia, the areas where Russia has strong influence, and the Middle East, we are seeing strong local and regional inclination toward the very same problematic drug policies that the US for so long promoted. Now, what changes specifically are taking place? Well, the really big breakthrough for the US came in Afghanistan, where the Obama administration decided to defund the drug eradication in the year 2009 and stop funding eradication in the country. And that was a big breakthrough. It was a big intellectual breakthrough that came through from the opposite of what Liz and Greg have been involved in, not through bottom-up organizing, but really through changes at the policymaking level, of recognition that eradication was significantly complicating the counterinsurgency effort against the Taliban. And a whole set of changes slowly but surely followed through. Some of them were led by the legalization of cannabis in various US states that made certain US international policies unsustainable, but lots of which was also linked to learning across a whole set of domains. And so we are at a really interesting moment now where the Biden administration released its drug policy statement in April. And for the first time, the supply side policy talks about human rights as being a crucial determinant, not sole, but crucial determinant of what supply side policy should look like. It doesn't use the word eradication once. We are on the cusp of the Biden administration releasing a new executive order. I encourage everyone to be paying close attention to what wording will be in that statement. There is much more focus in the Biden administration on issues such as getting away from problematic high-value targeting, focusing on financial flows. But I want to interject a bit of realism into this optimism as well. And namely that even the proposed change of policy that I think is heading in a very right direction is not going to be a magic bullet or magic wand to stop drug supply that creates its enormous problems. It's not going to be the solution alone to reducing violence in Mexico. In fact, violence in Mexico is often taking place because the López Obrador administration has just given up any policy to counter the violence and simply letting the violence to take place. And so I think that what we need to be ready for in the drug policy world is a realization some years down the road that the new policies will not have undone the problems. They will not remove violence, they will not remove supply, they will not even necessarily allow for lesser negative effects like with respect to the supply of synthetic opioids and the overdose in the US. And so we need to be prepared for that and think about what adjustments to policies are necessary so that the policy pendulum doesn't just wholesale swing back to all the policies that we know are ineffective or counterproductive.
Thank you so much. So we now are going to turn to audience questions. And while I give people a moment to post their questions, I just want to thank all three of you for illustrating so beautifully the 3 points of this triangle and how they're interrelated: AIDS activism, harm reduction, and drug policy. Also, how on-the-ground grassroots organizing relates to policy at the highest levels. I mean, you've covered so much ground in such a short time. So I'll just kick off with a question, if I might. Balancing optimism with realism, as I think Vanda calls on us to do. I want to pivot to what Greg is pointing to, the future. What do you see as the strategies, the people, and the organizations that are going to lead us forward in the next couple of decades on all of these points of the triangle? I just would love your opinion on where we should be looking and where we should be putting our shoulders to the mill.
I mean, look, I can start. We're seeing the past few years have been difficult for lots of reasons, and we see a retrograde, the rightward ethno-national shift across the world. But if you think in my own country of the United States, when Barry Goldwater lost the election in the 1960s, the right started organizing. What we see today in the United States is not because of the Koch brothers or rich philanthropists. It's a plan, right? And we have not had a plan to think about how to sort of reinvent national drug policy, regional or global drug policy from the ground up or from the top down. And this means support for grassroots organizing, but also the policy work that Vanda and others do. And not to keep beating on this drum, there's not many people who really care about this. There's lots of other issues in the world that you'll find private foundations that will support. Global drug policy, it's a dime a dozen people who are going to support this work. So my thinking is that the grassroots is desperately important. It's where the change happens, but I don't really feel like we have much of a future, frankly, in the current philanthropic climate and in terms of support for people who use drugs and the organizations that are working to support them.
Thank you. Wonder if Liz, Vanda, you want to add? Looking towards the future.
The only thing I would add is that, in Canada, there's like vast numbers of Indigenous communities that have been negatively impacted by drugs and alcohol, obviously, for centuries as a result of colonization. And, we don't necessarily make the connections between what's happening in these countries as a result of the war on drugs and what people's lived experiences every day. And in the US, communities of color who've obviously been completely disproportionately overrepresented by incarceration and other kinds of human rights abuses and in unfair police practices and everything else. I think we need to really draw our attention to some of these huge structural injustices and take the conversation of drugs out of the picture and just ask communities how drugs fit, because the drugs are often the remedy to problems that have nothing to do with the drugs. And so I think part of the conversation has to be taking the bogeyman out of the conversation and allowing the reality of people's lives to be the thing that defines the next steps. So if somebody actually can have a good relationship with their drug use, I don't care if they use or they don't use drugs. What I care is that they're happy and they get their life in a place where they're stable and they have a reasonable quality of life and they can keep their family and they can have a job and live somewhere. And drugs have absolutely nothing to do with that. So for me, a huge part of moving forward is reshaping the conversation around what the problem is, taking it away from this drug war kind of thinking and really firmly planting it on the shoulders of our responsibility to each other, to communities, and to addressing these really systemic injustices that are just redefining and reshaping the way we think about what the future is. And when you think about being able to give somebody who uses drugs help and take out the notion that drugs are the problem, then it's really endless, the possibilities of kinds of problems, programs and interventions and services that we can do. We can provide, really, it's limitless. It's like, it includes everything from changing your curtains to helping you find work to whatever it is. And drug users can mobilize. And as that space opens, their voices will be more respected. And it just shifts the whole narrative. So for me, I think that's a huge piece of work that still has to happen. But as I see shifts in that direction, I notice that then people have more agency and more respect. And so the conversation can change.
Thanks so much.
Mm-hmm.
Panda, did you have something to add?
Sure. I would sort of endorse Liz's point about really being careful in identifying what is the source of problem. That can be very varied across institutional and cultural settings, and even within the drug space, and certainly across illicit economies. One of the narratives that is often promoted is that the fact that the drug trade is legal results in violence. Well, it might result in some forms of violence, but I mentioned earlier there is a huge variation in how violent trafficking groups are, and by and large, East Asian markets tend to be very peaceful in how drug trafficking groups behave, and violence is often interjected by the state by absolutely horrific genocidal policies, like the policies of President Felipe Duterte in the Philippines or Thailand. In contrast, in Latin America, drug trafficking groups, as all criminal groups, tend to be 2 orders of magnitude more violent than East Asia. And that's not true simply about drugs. That's true about extortion, kidnapping, a whole set of economies. And what this really means is what, in my view, is the biggest challenge for all kinds of public policy, which is a search for a sort of uniform solution that would be applied across the whole variety of cultural and institutional setting, and that somehow is assumed that it will not have to evolve. And very often in public policy, we don't have solutions that are applicable in their uniformity. And effective policies, in fact, need to be highly varied, highly tailored, and adjusted over time. And it is excruciatingly difficult. It's difficult for policymakers and parliaments that appropriate money. It is, Congress, obviously. It is difficult also for activists who often latch onto the opposite. What is the policy that's being seen as the problem? The opposite is then the right solution. And it might not be the right solution for all places and all the times. But policy tends to be like glue. Once you squeeze it out of the tube, it's very, very hard to get it out. It creates vested interest. And so to me, whether we look at drug policy or a whole set of other public policy issues, the issue is how to change our mindset that policy really needs to be about careful day-to-day evaluation, what is working in a locality and what is not working and what are the alternatives, as opposed to sort of latching onto kind of the silver bullets, magic wands, this is not working, hence, the opposite or something else is uniformly applicable. And there are some fields where we know that certain problems carry over and we want to avoid problems. We know that imprisoning users creates all kinds of problematic policy, so that is wrong policy to go, and it carries around the world. We don't know with the same certainty and the same applicability what is the correct response to mitigating criminal violence. It often highly varies. So, this is not to say that nothing has external validity beyond a particular setting, but really to emphasize the need for building institutional cultural setting assessments into policy and allowing far greater policy flexibility and willingness and capacity to adjust.
Thank you. So building on that theme of the local to the global, because we have limited time, I just want to put together 2 questions that I think are 2 sides of the same coin as the last thing for you to respond to. The first half of the coin is, since the U.S. is the architect of the global drug war, what are your hopes for the current administration? And then the other side of that coin turns to Myanmar and the Taliban in Afghanistan. What are the impacts of this development on opium cultivation and trade in Asia and globally? So, moving from the U.S. to developments in the Middle East and Asia.
Would you like me to start, Helena?
Sure. Thank you.
Okay, so the Taliban has announced as its policy to move toward a poppy ban. That is excruciatingly difficult for them to, in fact, implement effectively. And if they try to implement it, they will need to rely on even greater repression and risk alienating core internal constituencies in a very fragile and contested internal coalition, as well as losing some of the crucial assets with which they bought off local militias and power brokers not to resist them, and of course impoverishing a population that's already caught up in a terrible humanitarian situation with 90% of people in poverty and about a third of the population in acute food insecurity as well as chronic food insecurity. Nonetheless, they will probably try to be replicating their policy of the 1990s of using poppy suppression as a mechanism to achieve international legitimacy and to satisfy Russia, with whom they have significantly improved their relations. It's a new world, though. If the Taliban, in fact, try to maintain a ban for a year or two, it might find its Western European markets snatched away by synthetic opioids, which would be both catastrophic for the humanitarian situation in Afghanistan, but also not good for Western Europe. In Myanmar, we see big expansion of, well, let me rephrase that. We see essentially after the coup a lack of capacity and interest on the part of the regime to mount law enforcement responses to a whole variety of crime, including the production of methamphetamines. Poppy cultivation was taking place before. We don't really see much eradication, which is good, but at the same time, there is very little action against the flows of meth, tends to still be very selective, and we see the big arrival of or expansion of the presence of Chinese organized crime groups in both Myanmar and surrounding regions, often portraying themselves as proxies to, or at least as useful to the Communist Party in China. This is generating big flows of meth across the region, with Australia having unprecedented levels of seizures, suggesting unprecedented levels of flows. Japan, Philippines, Thailand, Indonesia, all really being flooded with meth right now. And unlike in the case of injection drugs, we don't have the same set of harm reduction policies or methadone maintenance, heroin maintenance type of policies to methamphetamine. So the issue of use is, and its very devastating effects in the case of meth substance use disorder, is generating real concern in East Asia.
Thank you so much. And so I want to apologize to Greg and Liz that we have run out of time. And so I'm hoping we get another chance to hear your responses to that question. But I want to go next to Kasia Malinowska-Sembrak, Director of the Global Drug Policy Program.
Thank you, Helena. Can you guys hear me? Excellent. Thank you, Helena. And thank you all. Incredible wisdom from our fellows. And I wanted to take a second to respond to a concern that was expressed and to say that, you know, we at OSF have been dealing with drugs, drug policy, harm reduction for close to 3 decades. And I've been a part of that process, and we've done it in very different constellations. You are here as fellows, and there are many others in different programs that have done tremendous work on drugs and drug policy. And so we're sort of moving into yet another process of changes of constellation. But I think the commitment remains, commitments to both drug policy and harm reduction remains. And I really look forward to working with colleagues in our regions to make sure that people do not feel abandoned and forgotten and left to fend for themselves. This was a great framing of what's needed in the future, and OSF will certainly stay a part of that future in this field. Thanks.
Thank you. And Alethea Jones will close us out.
Thank you, everyone, for joining us. This session was recorded, and we know over 200 people registered, and it will be shared with them and others into the future. Helena, Greg, Liz, Vonda, this was a masterclass on the issues and a passionate call to action. Thank you, Kasia and others, for your leadership, and we all hope that a newly reorganized OSF will ultimately be a stronger and better partner. And thank you to all the staff behind the scenes who made this event possible. Be well.